Hi, this is Dr. Ghimire. I want to talk to you today about effects of obesity and how it can affect your overall health. Obesity is a chronic illness, right? It is not something that you just developed over the past several months. It is something that happens over a lifetime. And if you don't tackle it, it leads to other disease states out there. So how does obesity affect somebody in their 30s, 40s, and 50s? So in our teenage years or early 20s, we have a lot more testosterone, lean body mass, and as life happens, as we get married, go to college, universities, or join the workforce, we don't spend as much time taking care of ourselves or working out or doing physical activity. So the weight starts to slowly pile up. And also, as decades go by, each decade you lose about 3 to 5% of your lean body mass. So your weight starts to creep up. You're taking more processed food or more foods with high sugar content and less exercise, and your weight starts going up. You notice a bulge in your belly, your sides, your thighs, clothes don't fit really well, and now you've got a problem. And eventually what will happen is that if you go to your doctors, they're gonna counsel you lose weight, you're going to develop blood pressure, your cholesterol is going to be up, you're going to be at risk for prediabetes or diabetes, you might have sleep apnea, you might have early signs of heart disease, and the list goes on and on and on. So why is obesity also a risk factor for you at work and so forth? So first of all, it makes you look a little bit older, a little more tired, because what obesity does, it causes you to develop a high inflammatory state. You develop metabolic syndrome, your waist is higher, you feel tired all the time. If you develop sleep apnea, you're not getting enough rest. And this is a vicious cycle, it's hard to break. I'll give you my personal example. See this picture right here? That's me. That was me a couple of years ago. When I was working, I knew better, but work, stress, life, kids, all that stuff all happened to one, and I gained a lot of weight over this time frame. And I tried to exercise, I tried to eat right, and nothing was helping. So I just turned 43, and it was a long and loud wake-up call for me as to why I need to get healthy, or I might not be around to see my kids going through college, getting married, and have grandkids, and I want to live my best life. So for me, it was a big wake-up call. So today, I want to tell you about how losing weight, even 5% of your body weight, can have tremendous impact on your cardiovascular health, your energy, and your risk factor goes down. So I want to talk to you about how weight loss is incorporated into our primary care practice here at Luminescence. We want to focus on that because that is the centerpiece of wellness. If you have a good amount of weight, your ideal body weight or close to it, you will do better in the long run and reduce your risk of chronic illnesses. So let's talk about that. So in terms of obesity, how it affects you, there are studies out there that show that people that are obese, from overweight to obese, class 1, class 2, class 3, are at increased risk for dementia in the latter part of their life. They're also at risk for sleep apnea, cardiovascular disease, peripheral vascular disease, cerebrovascular disease, and the biggest one is cancers. It's well known colon cancer, pancreatic cancers are a risk factor for people with obesity. We see a lot of young people developing cancers and bad cancers that can limit your life. So in terms of trying to fight obesity, obesity is one of those things that we can help you get healthier. And it starts with the 5 pillars of obesity, right? So it is nutrition, diet as being number 1. Number 2 is exercise. Number 3 is being mindful, not having those empty calories that you don't need, and not eating like a box of chocolates or ice cream or things that are high glycemic index, and it's going to and cause a lot of insulin release, and also medications and surgery. So here at Luminescence, we prioritize the first 4: nutrition with diet, exercise, mindfulness, and medications. And the medications I'm talking about, we have the FDA approved medications such as semaglutide and tirzepatide. We also have other medications, the older ones such as phentermine, topiramate, orlistat, or bupropion. We can go over all of those with you as to see which one might be the right fit for you. We're also going to incorporate nutrition. Nutrition is excellent in terms of getting you to weight loss, but there's certain physiological factors out there that might cause you not to be able to lose the weight. So we can go over all of those. And in terms of taking care of your other comorbidities, we also offer primary care services here at Luminescence. We can monitor your blood pressure, cholesterol, prediabetes, diabetes, all of those things that you may have. So here at Luminescence, we prioritize your health, your wellness. We want to be part of you in this weight loss journey, wellness journey, so that you have the best life ahead for many, many years to come. So if you have any questions or concerns, please reach out to us. We will be happy to talk to you more about it and be a partner with you. Thank you so much.